Okay, so the first question was why use theories in clinical practice? I said that according to Smith et al. 2020, theories are patterns that guide the thinking about being and doing of in nurses. As nurses, we are constantly witnessing trauma, illness, and are surrounded by a lot of sadness and grief sometimes. And so the use of theories not only allows us to provide quality care for a patient in these type of circumstance, but it also helps us understand and create meaning from our experience. Does the theory use make a difference in care? So according to McRae's 2012 article, it found that there was no difference in how nursing care was provided. However, throughout the course, I've been researching Orem's self-care deficit theory, and I found that there was a lot of research studies that actually used this theory to see if there was any clinical results, I guess. And so it found that a lot of the research studies found that Orem's theory positively influenced the results and patient satisfaction. And so this was also addressed by McRae's article, and it stated that the most widely used model is that of Orem's. So I think that it just depends what theory is used in order to make a difference in care. The third question said, how would you know if a nurse was using a theory to support working with a patient? So you would know if a nurse was using a theory to support working with a patient because the nurse would be using patient-centered care. This means that they are meeting the patient's needs and are addressing any concerns that they may have. The nurse is also providing any other type of resource that the patient needs. So, if they need like a therapist or something, or certain resources to help them financially, or any type of housing, so help them that way, or and just like overall treating them holistically and not just for their disease. The next question is, what would you notice if a nurse was not using a theory? So it would be, I don't think it would necessarily be with one patient where you would notice it. I think over time it would be noticeable if a nurse was not using a theory, because the patients would not be able to trust their nurse, and their relationship would not be very stable, and so it would be very difficult for the patient to then basically follow directions or listen to any patient education that the nurse wants to provide for them. Their outcomes in terms of health would not be the best for their patients. So I think that's how you would know that a nurse is not using a theory. The last question was, how would theory use in the clinical setting impact nursing quality, safety indicators, and patient outcomes? A use of a theory would positively influence the quality, safety indicators, and patient outcomes. As I mentioned, Orem's self-care deficit theory did that for multiple research studies, and so I know that there are other theories out there that can and have done the same effect that Orem's theory has used. So I think that they can positively influence the quality, safety indicators, and patient outcomes.